Let's continue our discussion with diagnosis according to Zhang for organ patterns. Today we discuss lung wind heat invasion. Invasion of wind heat, like wind cold, is usually an acute pattern, while an invasion of wind cold will often, but certainly not always, arise from climatic influences such as cold or drafts. An invasion of wind heat can be caused by exposure to climatic influences and also by infectious pathogens such as bacteria and viruses. Where wind cold invades the body via wave chi in the skin, wind heat can also invade the body by the mucous membranes in the nose and mouth. Again, allergens and other influences from the outside of the body can give rise to a wind heat reaction, and as described earlier, it is the symptoms and signs that define the pattern. What's the wind heat etiology? It's exposure to climatic factors or to bacteria, viruses, allergens, and so on that have a wind heat dynamic. There may be an underlying lung qi deficiency, which makes it easier for exogenous qi to invade the body. What are its symptoms and signs? First, we have cough. There is sore throat, where the throat is red, and there are possibly swollen tonsils, blocked nose or sinuses, sticky yellowish mucus, headache, sweats easily. The patient will have fever, thirst, will experience aversion to cold, though not as pronounced as it is when there is wind cold. The nose or the area around the nose may be red. The forehead may feel warm when palpated. The eyes may be red or irritated. The tongue can be slightly red in the front third and have a thin yellow coating. And the pulse is rapid superficial, especially on the right tone position. Its key symptoms are fever, aversion to cold, and a rapid superficial pulse. For its treatment principle, we have to expel wind heat, activate the wei qi, and regulate lung qi. For the choice of acupuncture points, we may choose from lung 7, Li4, Sanjiao 5, Li11, UB12, Du14, and GB20. We may use the training needling technique. We can also use vacuum cups on urinary bladder 12 or gua sha on the upper back. As for the explanations of the choice of points, lung 7 and Li4 regulates lung functions of descending and spreading. They enable wei qi and expel wind and heat. GB20, Sanjiao 5, and UB12 expel wind and activate wei qi. Lung 11 and Du14 expel heat. Here's a relevant advice. When there is an acute invasion of exogenous qi in the exterior, it is advisable to consume beverages that are cooling and spicy, such as mint, chamomile, chrysanthemum, or elderflower, to open the exterior and expel wind heat. Fasting is also advisable. Fasting temporarily means that qi will not be used to transform food and can therefore be used to combat the invading qi. Furthermore, some sources are also of the opinion that the downward movement of food and qi in the stomach created by eating food can draw the exogenous qi inwards from the surface. Similarly, the sour flavor should be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour should not be consumed during an invasion of exogenous qi cold, as they will draw the pathogenic cold inwards while closing the pores in the skin, thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage as they are cold and drain downward. Invasion of wind heat can be caused by lung qi deficiency, and in turn, it can result to wind heat, phlegm heat in the lung heat, yang wind heat, and Xiaoyang disorders. To summarize, wind heat invading in the lung has its etiology in exposure to climatic wind and heat, and a possible weak defensive qi or weak qi. Its signs and symptoms are cough, fever, aversion to cold, scorching sore throat, stuffed nose with snivel, cough with yellow mucus, headache, body ache, slight sweating, thirst, swollen tonsils, slight aversion to cold. The pulse will be floating and rapid, and the tongue will have red sides or tip. Coating may be yellow or yellowish white and thin. The treatment principle would be to release the exterior and expel wind heat. For our acupuncture treatment, we can use lung 10 to clear lung heat, Li11 to release the exterior and clear heat, lung 11 to clear the lung heat. We can do cupping on bladder 12 to expel wind. We can also use gallbladder 20 to expel exterior wind, lung 5 to clear phlegm, Li4 to release the exterior and clear heat, stomach 44 to descend stomach qi, do 14 to clear heat, do 16 to expel exterior wind, and Sanjo 5 to expel wind and clear heat. We use, for the needling technique, we needle with drainage. For headache, we can add 220, Taiyang, and SI3. For spontaneous sweating, we can add Li4 and kidney 7. For nasal congestion without snivel, add Li20 and the extra point in tongue. For scorching sore throat, prick lung 11 to bleed. For cough with yellow phlegm, we can add bladder 13, Li4, and Li7. Thank you for listening.